Can cats have mental illness? The answer is yes. Can cats go crazy? In 2014, Laurel Braitman, PhD, published Animal Madness, a book based on her personal experiences and scientific observations. As Dr. Braitman writes, madness is a mirror that needs normalcy to exist. That line can be blurry. And indeed, it can. Every cat is different. What looks like bad behavior might be a cry for help. Want more insight into feline emotions and care? Subscribe to our channel for expert tips, real-life stories, and compassionate advice. Hit the bell so you never miss a meow. Let's list the psychological factors that affect our cat's behavior. Obsessive-Compulsive Disorder, OCD, in cats is a behavioral condition marked by repetitive, exaggerated actions that appear to serve no clear purpose. Common examples include excessive grooming that leads to skin irritation or bald patches, pacing, vocalizing, overeating, and sucking or chewing on fabric or plastic. Certain breeds, especially Siamese and other Asian breeds, seem more prone to OCD-like behaviors. Although these actions may seem purposeless, they often have an underlying cause. Before diagnosing a behavioral disorder, veterinarians will typically rule out medical issues. Potential causes include parasites, fungal or bacterial infections, allergies, skin cancer, and pain. Spaying or neutering may help reduce certain compulsive behaviors, especially those linked to hormonal cycles. Additional strategies to support behavioral health include maintaining consistent feeding schedules, reducing household stressors and unpredictability, prioritizing play, exercise, and social interaction, the increasing dietary fiber or switching to a new diet, particularly to curb fabric sucking or chewing. With proper diagnosis and a tailored care plan, many cats with OCD-like behaviors can experience significant improvement in comfort and quality of life. Behavioral therapy and environmental modifications are also essential, including establishing a predictable daily routine, using reward-based training that encourages desirable behaviors without punishment, offering rewards only when appropriate behaviors are displayed, scheduling regular social interaction sessions, play, exercise, training, providing quiet rest areas and stimulating toys that incorporate food or texture to maintain interest between sessions. Alopecia in cats. Alopecia, or hair loss, can occur when cats overgroom, either through excessive licking or pulling out tufts of fur. Psychogenic alopecia is diagnosed as a compulsive disorder only when no underlying medical issue is found. Most cases of alopecia are caused by medical conditions such as fleas or other external parasites, flea bite hypersensitivity, inhalant or food allergies, infections, or internal organ or endocrine dysfunction. Cats are naturally meticulous groomers, spending 30% to 50% of their waking hours grooming. Like other compulsive disorders, psychogenic alopecia may begin as a displacement behavior triggered by conflict, frustration, or anxiety, and may become compulsive over time. To help calm and occupy your cat, increase interactive play, chase toys, training. Provide environmental stimulation, play centers, chew toys, food, or catnip-filled toys, kitty videos. Rotate toys daily to keep them novel and remove them after play. Offer toys that can be chased or batted, especially those filled with treats. Use cardboard boxes, paper bags, and new climbing or perching areas when you're away. Provide social play and basic food reward training when you're home. Attention should never be given to the cat when the compulsive behavior is exhibited. Instead, use inattention or remote deterrence, e.g., water spray, compressed air, ultrasonic alarms, to interrupt the behavior without creating fear. Once the behavior stops, immediately redirect your cat to a positive activity like play or chew toys. Identify environmental or social stressors contributing to the behavior. If conflict exists, whether with humans or other cats, a targeted resolution plan may be needed. In multi-pet households, giving the affected cat quiet time away from others may be essential if inter-cat conflict is contributing. Feline Hyperesthesia syndrome, FHS, is a rare and poorly understood condition that can affect cats of any age, though it most commonly appears in mature cats. Also known as rippling skin syndrome, rolling skin syndrome, or twitchy skin syndrome, FHS causes cats to react intensely to physical stimuli that typically wouldn't cause pain. The skin and muscles along the cat's back may ripple or twitch in a distinctive way during an episode. This condition appears to be more common in Asian breeds, particularly Siamese cats. According to Dr. Alexander de la Junta, DVM and Professor Emeritus of Anatomy at Cornell University, these symptoms may be linked to a seizure disorder. He notes additional signs such as salivation, intense vocalization, and uncontrolled urination. Other behaviors may resemble obsessive-compulsive disorder, OCD, including excessive grooming or biting at the flank, tail, or back. In hyperesthesia, the affected cat may have a more exaggerated response to touching, rubbing, or scratching of the back. Cats with FHS may display dilated pupils, sudden startling or hallucination-like reactions, muscle spasms, and vocalization, dashing away unexpectedly, defecation during episodes, grooming or biting at the tail, back, or flanks. These behaviors may begin as normal responses to stimulation but can escalate into compulsive patterns, especially in high arousal or anxious situations. If the cat bites and injures its tail, the damage may become severe enough to require amputation. However, surgery does not address the underlying behavioral cause. Treatment should include medical care to manage infection and pain, protective devices like e-collars or bandages, behavioral therapy and medication for compulsive disorders, identifying triggers that precede tail-chasing episodes, establishing predictable routines, providing daily interaction and attention. If the behavior is rooted in anxiety or conflict, especially with other pets, allowing the cat quiet time away from household stressors may be necessary. Anxiety disorders in cats. Cats are both predators and prey by nature, which makes them especially sensitive to stress and anxiety. Their instinct to remain constantly alert, even in safe environments, can lead to chronic tension. While your cat may not need to worry about wild animals interrupting their afternoon nap on the couch, they can still suffer from anxiety disorders. According to estimates, approximately 20 to 25% of feline veterinary patients exhibit anxious behaviors. Feline anxiety is a state of nervousness or worry triggered when a cat anticipates danger or threat, even if no real threat exists. This activates the fight-or-flight response, releasing stress hormones that prepare the cat to either confront or escape the perceived danger. Although feline anxiety is not considered a medical emergency, prolonged stress can lead to serious health issues such as feline idiopathic cystitis, FIC, or skin conditions. Common types of feline anxiety: generalized anxiety, chronic anxiety caused by various environmental or internal factors; noise-associated anxiety, triggered by loud sounds like thunder, fireworks, or vacuum cleaners; separation anxiety, occurs when cats are separated from their primary caregiver; female cats, cats living alone or without other pets, and those with a history of abandonment are more prone. Siamese, Burmese, and Tonkinese breeds are especially susceptible. Symptoms of anxiety in cats. Symptoms vary depending on the trigger. For example, cats with separation anxiety may become clingy and agitated when they sense their owner is about to leave. General signs include body language changes, tail tucked, dilated pupils, ears held back, avoiding eye contact, flicking tail, staring, hiding or escaping, scratching or chewing doors/windows when feeling trapped, inappropriate urination, avoiding the litter box, overgrooming, excessive licking that may cause hair loss or skin wounds, excessive vocalization, frequent meowing in an unusual tone, appetite changes, eating significantly more or less than usual, gastrointestinal issues, vomiting or diarrhea, reactivity, aggression or irritability toward people or other pets. Diagnosing anxiety in cats. If your cat shows signs of anxiety, consult your veterinarian. A detailed history of environmental changes and a video of your cat's behavior can be helpful. Since illness and pain often underlie anxiety, your vet may perform blood tests, urinalysis, X-rays, other diagnostics to rule out medical causes. Treating feline anxiety. Treatment begins with addressing any underlying health condition. If no medical issue is found, your vet may recommend. Avoiding triggers. Minimize exposure to known stressors. Medication, anti-anxiety drugs, or antidepressants tailored to your cat's needs. Behavior modification. Desensitization, gradual exposure to triggers at low intensity. Counterconditioning, creating positive associations with triggers, e.g., treats before and after vacuuming. If anxiety persists and affects quality of life, consult a veterinary behaviorist. Recovery and long-term management. Treatment for feline anxiety is often long-term. Mild cases may improve within 4 to 6 months, while moderate to severe cases may require lifelong care. Tips to reduce anxiety. Leave the carrier out so it becomes familiar. Avoid incense, plug-ins, essential oils, and scented candles. Keep litter boxes clean, quiet, and accessible. 2 per cat recommended. Create a quiet, cat-safe zone during gatherings with soft music. Provide daily physical and mental stimulation. Prevention. Expose kittens to a variety of sights, sounds, and experiences early on. Teach independence by offering puzzle toys during alone time. Anxiety disorders can significantly impact a cat's health and well-being. If you suspect your cat is struggling, contact your veterinarian to rule out medical causes and explore treatment options. FAQs. Can cats have panic attacks? Yes. Cats with noise phobias or severe anxiety may experience panic-like episodes similar to humans. Bonus tip: scheduling feeding and playtime CA and help. Avoid scratching your cat's back if it triggers muscle spasms. Some cats may react aggressively to pain, leading to distressing behaviors. Feline cognitive dysfunction, FDS, sometimes called senility, is a frequently confusing disorder that mostly occurs in elderly cats over the age of 15. Litter box problems may be the first sign, followed by aimless wandering, confusion, getting stuck in corners, and an inability to recognize familiar people or family. These behaviors are sometimes medically caused by a waxy protein known as beta-amyloid deposits in the brain. It is precisely what causes Alzheimer's disease in humans. Anxiety, fear, tremors, vocalizing, licking the floor or objects, reversing or disrupting sleep cycles, and changing interaction with family or pets may become evident. Mental stimulation, puzzle toys, and entertainment such as bird feeders that cats can watch are helpful tools to keep your cat mentally alert. Giving cats places to lounge and climb, hiding treats around the house so they have to hunt, and even teaching your cat to walk on a leash for outdoor stimulation can keep their minds limber and healthy. I did that with my first Siamese cat, and he loved it. Depression in cats. Sometimes you move to a new home, or you bring in a new cat or dog. Maybe someone your cat loved isn't around anymore. Maybe you've been leaving your cat alone more than usual. All of these changes can lead to feline depression. So, let's take a look at the signs. Changes in voice. Cats communicate primarily through vocalization. If your cat is in pain, she may produce low-pitched, mournful yowls. Another sign is when a typically talkative cat becomes unusually quiet and stops meowing as often. Shifts in pitch and volume can also signal underlying restlessness. Your cat may begin purring more frequently as a form of self-soothing. Conversely, if a normally quiet cat suddenly becomes loud and vocal, it could be a sign of emotional distress or anxiety. Body language. A depressed or anxious cat often shows signs of unease through posture and movement. For example, she may hold her ears back, tuck her tail, or raise her fur when feeling unsettled. Cats rely heavily on body language to communicate, so it's important to observe and interpret these signals to understand how your cat is feeling. Aggression or fear. Sad or emotionally disturbed cats may become more sensitive and react to stimuli with aggression or fear. A cat that is unusually aggressive or skittish is often not at peace and may be expressing anxiety through defensive behavior. Stranger anxiety and clinginess. Depressed cats may become overly clingy, constantly seeking attention from their owner. While most cats are naturally cautious around strangers, depression can intensify this anxiety. You may also notice a loss of interest in favorite activities like playing hide-and-seek, hunting for treats, watching TV, or chasing string toys. Increased reclusiveness can be a subtle cry for help. Changes in sleep routine. Cats typically sleep 12 to 16 hours a day. However, a depressed cat may sleep even longer and may change her usual napping spots. These shifts can indicate emotional discomfort or withdrawal. Changes in appetite. Mental distress can lead to a reduced appetite. Your cat may lose interest in food and eat less than usual, even ignoring her favorite treats. This is a common sign of depression or anxiety. Breaking house training habits. Depressed cats may urinate outside the litter box, even if they're normally well-trained. This behavior can be comforting to them, as the scent of their urine provides a sense of familiarity. Cats experiencing emotional distress may choose unusual places like bedrooms, kitchens, or dining areas to urinate. Excessive scratching. Cats may cope with stress and anxiety by scratching excessively, both on nearby objects and on their own bodies. This behavior can offer temporary mental relief and is often a sign that your cat is trying to self-regulate her emotions. Recognizing PTSD in cats. Spotting the signs of post-traumatic stress disorder, PTSD, in your cat early is essential. Timely intervention can ease their symptoms and help them live a happier, healthier life. PTSD in cats is an anxiety disorder that may develop after exposure to a terrifying event or situation involving actual or threatened physical harm. This condition can lead to dramatic behavioral changes and ongoing emotional distress. While not all cats who experience trauma will develop PTSD, those who do may benefit greatly from proper treatment and support. Understanding your cat's normal behavior and routines is key to identifying PTSD. Behavioral changes can lead to secondary health issues if left untreated. Keep a record of any unusual behaviors to share with your veterinarian. Common signs of feline PTSD include uncharacteristic aggression. Defensive behaviors such as biting, scratching, or clawing may emerge, especially in stressful situations like loud noises or unfamiliar guests. Fearfulness, trembling. Shaking cats may tremble or shake in response to perceived threats. These symptoms can also indicate underlying medical conditions, so prompt veterinary care is essential. Decreased appetite and weight loss. Trauma may disrupt eating habits, leading to unhealthy weight loss. Your vet may recommend dietary adjustments to support recovery. Reduced interest in play or social interaction. A lack of motivation or energy may signal emotional distress. Cats may withdraw from play or avoid contact with people and other pets. Hypervigilance. Constant alertness and sensitivity to movement, sound, or environmental changes may reflect a heightened fear response. Inappropriate elimination. Urinating or defecating outside the litter box may be a coping mechanism. PTSD-related elimination issues can include straining or choosing unusual locations. Increased clinginess or attachment. While affection is normal, excessive neediness or vocalization may indicate anxiety. Tracking when these behaviors occur can help identify triggers. Excessive meowing or yowling. Heightened vocalization is often a sign of distress or discomfort. Destructive behavior. Scratching furniture or other destructive actions may be a way for your cat to release pent-up stress. Sleep disturbances. PTSD can disrupt sleep patterns. If your cat is restless at night or wakes frequently, this may be a sign of emotional turmoil. Pacing. Roaming or pacing may reflect panic or an inability to relax. Avoidance or hiding. Cats may avoid people, places, or objects associated with past trauma. This is one of the clearest indicators of fear-based memory. Treating trauma in cats. Only a licensed veterinarian or veterinary behaviorist can diagnose PTSD in cats. Treatment may include environmental management. Creating a calm, predictable space can reduce stress. Counterconditioning. Helping your cat form positive associations with previously feared stimuli. Desensitization. Gradual exposure to triggers at tolerable levels to reduce reactivity. Medication. Anti-anxiety medications may be prescribed to support behavioral therapy. Always consult your vet before starting any medical treatment. Desensitization is often the cornerstone of PTSD care in cats. FAQs. How do I know if my cat is traumatized? Look for sudden changes in behavior, appetite, sleep, or social interaction. Aggression or withdrawal may also be signs. What happens when a cat is traumatized? Trauma can cause lasting fear and hypervigilance. Cats may react to internal or external stimuli that remind them of the event. Can a cat recover from trauma? Yes. With proper veterinary care, counter-conditioning, and desensitization, many cats recover and regain emotional balance. Thank you to Cornell University and the Cornell Feline Health Center for your inspiring work in feline research and care.